a dramatic health production.
My name is Alison, and I've been married for, it'll be 6 years in October, and I have 3 children. It wasn't until we were married that we were talking about having a family, and I thought it was going to be easy, and that didn't happen for us. Early on in my first pregnancy with James, there really wasn't any issues, so I received pretty much a normal prenatal care. The Dr. Terrani prenatal care, which is a little bit more than the normal doctor does, and he just kept on it. Make sure you come to your visits, make sure you're taking your prenatal vitamins, do this, do that, and the other thing. And at about 27, 28 weeks, I started having contractions, preterm labor, and I went to the hospital. And after that is when my blood pressure started going up. I wound up with a severe preeclampsia with James.
Preeclampsia is one of the worst complications of pregnancy. Happens up to 6% of all pregnancies, and that's #1 leading cause of maternal death. And usually has 3 components: very high blood pressure, and edema, meaning swelling of the face and the entire body, and a lot of protein in the urine.
I had to keep a log of all my blood pressures. Towards the end of the pregnancy, I was being seen 3 times a week for blood pressure checks, biophysicals, and STs, just to make sure the baby was okay.
The main problem with preeclampsia is that patients don't feel it. She came to the office smiling and happy, and nothing's wrong with me, and it's a beautiful day, and you check the blood pressure is very high. We don't trust it, we do it again on the other arm, and we do it a few times. And we initially tried to put her bed rest and some medications and very close monitoring of the baby. And at some point, because the baby was very premature, we had to hospitalize her and to watch her closely.
James showed signs of brain sparing. His head was very large and his body was very small, and it was from placental insufficiency because of my blood pressure. And that's eventually why they sent me to the hospital for delivery. And Dr. Terrani, really what he tried to do was he wanted to get me into 36 weeks at least.
In the situations for patients who have this condition, it's a very tough decision. Keep the baby in the womb or deliver the baby. So the problem is that we have to make sure the baby is as mature as possible. On the other hand, not to lose the baby by waiting too long. It's like us being in a room full of smoke, and we have to open the door and escape. And to detect that for the baby can be done only by using Dopplers and sonogram. That's when we know there's a smoke in the room, it's time to get out.
They scheduled me for an induction, but my blood pressure kept going up, even on magnesium. So eventually, Dr. Terrani just walked into my room, said, "You ready to have a baby?" And I just got so nervous and started crying because I was not expecting it so early. My husband panicked, basically. The anesthesiologist threw scrubs at him, and we were both like, "Now? Right now?"
I was great. I was nervous, but we trusted the practice and everything that was going on, and we knew that she was in great hands.
We called our families, and they were just in shock, came rushing over to the hospital, and everybody got there after James was already out and safe and okay, and he was perfect. With my second pregnancy, I didn't expect to have preeclampsia again. I just didn't think it would happen twice, like lightning doesn't strike twice in the same spot. But with my second one, everything was okay until about 26, 27 weeks again. I had a lot more of the headaches, the migraines, the sight blurring, and I got admitted to the hospital the day before I delivered her. And the very next day I turned 36 weeks, and that was when I had very bad headaches, visual issues. I spent the entire morning in the bathroom throwing up at the hospital, and the resident walked in, looked at me and said, "I think we need to have a birthday today." And he called Dr. Terrani. Dr. Terrani showed up within minutes, really, and he delivered Kayla.
So in Alison's case, any good doctor should know that history repeats itself. And because of age and timing, every pregnancy may become worse and worse. So we were even more careful about her future pregnancies. And we did fetal surveillance almost twice a week and checking her blood pressures 4 to 5 times a day. And I remember she had to record it and text me to her cell phone 5 times a day what blood pressure she had at home. That's a kind of close monitoring that saves lives.
When Connor was born, he was only 35 weeks, so I knew it was a possibility that his lungs would not be mature, and they weren't. So he needed a little bit of help. He was intubated immediately after he was born, and after that he was put into one of the little incubators for about 7 days, I want to say. But besides that, he has been perfectly healthy, and we are very lucky and very fortunate.
The decision to deliver a premature baby is a very tough decision for us, but nevertheless we have to do that. The same analogy of to get out of the room when it's too much smoke to save baby's life. Again, because of neonatal ICUs are very modern and technology has improved a lot. Today they can save babies as early as 24 weeks, and we do hear heroic outcomes. But 35 weeks babies, usually in general, by 90% of times they do good.
All 3 of my pregnancies, what Garden OBGYN did was they monitored me like I was their child. The way I watch my children is the way they watched me. I had 24-hour urines done every couple of days. I had preeclampsia blood work done every couple of days. I had biophysical profiles and NSTs and umbilical Doppler studies and MCA Doppler studies to make sure that everything was okay. And as soon as anything came back abnormal, I had a trip to the hospital.
We've had excellent success with women who have preeclampsia over the past 10 years. And again, thanks to our very close monitoring of women, we can diagnose it before it kills. And I believe that many women's lives have been saved by our efforts. The other problem with preeclampsia is that many times mothers have the baby and go home, and preeclampsia happens after childbirth. It can happen as late as 6 weeks postpartum. And again, thanks to our efforts with postpartum visits, we see all pregnant women after childbirth across the board. We see them 2 weeks postpartum. And by being very, very obsessive about that, we have saved many lives of mothers. And we have statistics that most likely we are more than 10 times better than national averages in that field.
I thank God every day that I met Dr. Terrani and that he took care of my pregnancies, because I am not 100% sure that I would have 3 healthy babies right now if it wasn't for him.
Alison came to us with their kids, James, Kayla, and Connor last Saturday. And one day I was looking at those kids and I said, thank God that we watch these kids and these kids are alive. And I believe wholeheartedly that over the years, there are many, many families very happy with the healthy children thanks to our efforts.